Robotic-Assisted Thyroidectomy, Efficacy and Safety Profiles. Thyroidectomy, the surgical removal of part or all of the thyroid gland, has evolved significantly with the advent of minimally invasive surgical techniques. Among these, robotic-assisted thyroidectomy has emerged as a promising alternative to conventional open and endoscopic approaches. This surgical innovation leverages robotic systems to enhance precision, reduce invasiveness, and improve cosmetic outcomes. With an increasing number of patients and surgeons opting for robotic-assisted procedures, it is crucial to evaluate the efficacy and safety of this technique comprehensively. The adoption of robotic-assisted thyroidectomy has been particularly notable in cases where cosmetic concerns and improved visualization are priorities. The use of the Da Vinci surgical system has allowed surgeons to perform thyroidectomy through remote access incisions, avoiding visible cervical scars. This method has been widely adopted in countries such as South Korea, the United States, and parts of Europe, where patient demand for superior aesthetic outcomes has driven its popularity. However, despite its advantages, concerns regarding its safety, surgical outcomes, cost-effectiveness, and learning curve persist. This documentary explores the efficacy and safety of robotic-assisted thyroidectomy through a rigorous analysis of existing evidence, clinical outcomes, and comparative studies. It delves into patient benefits, surgical complications, oncological outcomes, and economic considerations while highlighting case studies and expert opinions to provide a comprehensive understanding of this surgical innovation. Historically, thyroid surgery was performed through a traditional open approach, involving a transverse cervical incision. This technique provided direct visualization of the thyroid gland and surrounding structures, ensuring safe resection. However, the open procedure left a visible scar on the neck, leading to patient dissatisfaction, particularly among younger individuals and those in cultures where cosmetic appearance is highly valued. In response to these concerns, minimally invasive video-assisted thyroidectomy, or MIVAT, emerged in the early 2000s, allowing for smaller incisions and improved cosmetic results. While this approach reduced scarring, it had limitations, including restricted visualization and instrument maneuverability. The introduction of robotic-assisted thyroidectomy sought to address these issues by offering an advanced alternative with improved dexterity, three-dimensional visualization, and better access to deep-seated tissues. Robotic thyroidectomy was first popularized in South Korea by Dr. Woong Yun Chung, who developed the transaxillary approach. This technique involved accessing the thyroid gland through an incision in the axilla, eliminating the need for a neck incision. Over time, multiple approaches, including the bilateral Axillo-Breast approach or BABA, and the retroauricular facelift approach, were introduced to further refine the technique. The efficacy of robotic-assisted thyroidectomy has been evaluated in numerous studies comparing it to conventional open and endoscopic procedures. Several key parameters, including surgical outcomes, recurrence rates, operative time, blood loss, and cosmetic satisfaction, have been analyzed to determine the effectiveness of this approach. Multiple comparative studies have demonstrated that robotic-assisted thyroidectomy achieves equivalent oncologic outcomes to open thyroidectomy in cases of benign and malignant thyroid disease. A systematic review published in the Journal of Surgical Oncology analyzed 2,500 patients undergoing robotic and open thyroidectomy for papillary thyroid carcinoma. The study found no significant difference in recurrence rates between the two groups over a 5-year follow-up period. Additionally, robotic surgery provided superior visualization of critical structures such as the recurrent laryngeal nerve and parathyroid glands, reducing the risk of inadvertent injury. One of the most significant advantages of robotic thyroidectomy is its ability to enhance precision through magnified three-dimensional imaging and articulated instruments. Unlike conventional laparoscopic instruments, robotic arms provide a greater range of motion, allowing for meticulous dissection and improved hemostasis. A study published in Thyroid reported that patients who underwent robotic thyroidectomy had lower rates of inadvertent parathyroidectomy and reduced transient hypocalcemia compared to those who underwent open surgery. Despite these benefits, operative time remains a major consideration in assessing the efficacy of robotic-assisted thyroidectomy. Several studies have reported prolonged operative times associated with the robotic approach, particularly during the early learning curve. A meta-analysis conducted by surgical endoscopy found that rat procedures lasted approximately 30 to 50 minutes longer than open thyroidectomy, with the extended time attributed to the need for robotic docking and extensive dissection through remote access incisions. However, as surgeons gain experience, operative times tend to decrease, approaching those of traditional techniques. Patient satisfaction is another key indicator of efficacy. And multiple surveys have demonstrated higher satisfaction rates among individuals who undergo robotic thyroidectomy. A study in Annals of Surgery found that over 90% of patients who underwent the transaxillary approach reported high satisfaction with cosmetic outcomes, with significantly improved quality of life compared to those who had open surgery. The elimination of visible neck scars was cited as the primary factor influencing patient preference for the robotic approach. The safety of robotic-assisted thyroidectomy is a critical aspect that determines its widespread adoption. While the technique has been associated with favorable outcomes, potential complications must be carefully considered. Key safety concerns include recurrent laryngeal nerve injury, hypoparathyroidism, hemorrhage, and complications related to the remote access approach. Recurrent laryngeal nerve, or RLN injury, is one of the most serious complications of thyroid surgery, as it can lead to vocal cord paralysis and significant morbidity. Studies comparing robotic and open thyroidectomy have shown similar rates of RLN injury, ranging from 0.5% to 3%. The improved visualization provided by robotic systems allows surgeons to identify and preserve the RLN more effectively. In a multi-center study published in the World Journal of Surgery, robotic thyroidectomy demonstrated a lower rate of transient RLN injury at 1.2% compared to open thyroidectomy, which was 2.8%. However, permanent RLN paralysis rates remained comparable between the two techniques. Hypoparathyroidism, resulting from inadvertent removal or devascularization of the parathyroid glands, is another concern in thyroid surgery. While transient hypocalcemia is common following thyroidectomy, permanent hypoparathyroidism is a devastating complication. A comparative analysis in surgical laparoscopy, endoscopy, and percutaneous techniques found that robotic-assisted thyroidectomy was associated with lower rates of transient hypocalcemia, 6.5%, compared to open thyroidectomy, 12.3%. This difference is attributed to superior visualization and careful gland preservation. Despite these favorable safety outcomes, robotic-assisted thyroidectomy is associated with unique complications related to the extensive dissection required for remote access incisions. Brachial plexus injury, occurring due to prolonged arm positioning during the transaxillary approach, has been reported in up to 2% of cases. Additionally, surgical site infections and seroma formation at the axillary or retroauricular incision sites have been noted in some studies. The overall complication rate of robotic thyroidectomy remains comparable to that of conventional techniques when performed by experienced surgeons. However, the steep learning curve associated with this approach necessitates specialized training to ensure patient safety. A study in the Journal of Robotic Surgery suggested that at least 30 to 50 cases are required for surgeons to achieve proficiency in robotic thyroidectomy, emphasizing the need for structured training programs. One of the major criticisms of robotic-assisted thyroidectomy is its high cost compared to traditional techniques. The Da Vinci surgical system, the most widely used robotic platform, has a substantial acquisition cost with additional expenses for disposable instruments and maintenance. A cost-effectiveness analysis in JAMA Surgery estimated that robotic thyroidectomy costs approximately $3,500 to $5,000 more per procedure than open thyroidectomy, raising concerns about healthcare affordability and accessibility. Despite the higher upfront costs, proponents argue that robotic thyroidectomy may provide long-term economic benefits by reducing hospital stays and minimizing post-operative complications. A retrospective study in endocrine practice found that patients undergoing robotic thyroidectomy had shorter hospital stays, with a mean of 1.2 days, compared to open thyroidectomy, which had a mean of 2.5 days, potentially offsetting some of the additional costs. The financial burden of robotic thyroidectomy has led to limited adoption in many healthcare systems, particularly in countries with constrained resources. While robotic surgery is increasingly available in tertiary medical centers, its accessibility remains a challenge in community hospitals and rural areas. The ongoing development of cost-effective robotic platforms may help expand access to robotic thyroidectomy in the future. Robotic-assisted thyroidectomy represents a significant advancement in thyroid surgery, offering improved precision, enhanced visualization, and superior cosmetic outcomes. Its efficacy is well documented, with equivalent oncological outcomes and reduced rates of certain complications compared to traditional approaches. However, safety concerns, prolonged operative times, and high costs remain barriers to widespread adoption. As technology continues to evolve, the refinement of robotic platforms and increasing surgeon expertise may further improve the safety and feasibility of this approach. Future research should focus on long-term outcomes, cost-effectiveness, and broader accessibility to ensure that robotic thyroidectomy can benefit a larger patient population.